One thing we don't have is any official statistics that show the coronavirus toll by demographic. But in some communities, the pandemic appears to be disproportionately affecting people of color. Our national correspondent, Jericka Duncan, has been looking into this. Jericka, good morning. We heard David Begnaud report earlier today that he observed mostly black men in the ICU in the hospital where he was. Very interesting finding there. What have you found?
Well, it's no secret, Tony, that African Americans have a higher rate of things like diabetes, asthma, hypertension, those underlying conditions that we talked about that have led to the deaths of people with coronavirus. And because of that, one local health commissioner who calls racism a public health issue says she's taking the lead by collecting important information that she says could help save lives.
We're in the middle of the storm right now. We need as much data as possible. Right now, we're flying blind.
Milwaukee Health Commissioner Jeanette Kowalik is overseeing roughly 1 million residents in Milwaukee County.
Of the 40 people who have died so far because of the coronavirus in your county, what percentage of those people are Black?
Right now, it's still about 80%.
African Americans make up 26% of the population?
Correct.
Right now, the CDC is not collecting data on the race of those who've tested positive or died from coronavirus.
It's important to actually document the race of the people who are infected and dying.
Everyone will be affected by this, but there are some communities and populations that are going to be affected even more significantly.
Dr. Uche Blackstock is founder and CEO of Advancing Health Equity in New York City.
The reason why we need to really discuss this issue and to collect the racial and ethnic demographic data on who is tested, who has the disease, and on who's dying from it is so that we can properly allocate healthcare resources equitably to the communities that need it.
Dr. Blackstock also works part-time at urgent care facilities in Brooklyn.
Can you describe the makeup of the people in your waiting room right now?
We're noticing more Black and brown and immigrant patients that are seeking care. And a lot of these patients are essential workers. A lot of them are service workers.
She says testing is still not readily available.
How many COVID-19 tests are you all able to give each day?
We are instructed that we probably should not test more than 1 in 10 patients.
So 10%, exactly. No more than 10% of the people that come through there every day.
Our criteria is really, we're focusing on the highest risk patients.
CBS News contributor Ibram X. Kendi is also director of the Anti-Racist Policy Center at American University.
If we don't have an awareness right now of racial disparities, we can't right now figure out what's causing those racial disparities. What policies or even lack thereof, then we can't change it right now in the moment when people are dying and being infected.
And according to a new report by WBEZ Public Radio in Chicago, an analysis of the county found that 70% of people in Chicago who have passed away because of coronavirus are Black. And you're talking about nearly 300 deaths right now in the whole state of Illinois because of coronavirus. But definitely important information when you look at how we track other diseases, other viruses, and this being a pandemic. I'm sure there are a lot of people that are hungry for that information right now.
I'll say, Jericka, this is such an important story. We've heard this saying all the time, knowledge is power, and all of your experts seem to say that you need more information to know exactly what you're dealing with and how we need to fight it. So glad that you were raising this issue. Thank you very much, Jericka Duncan, reporting from her home, too.
Thank you.